you're joining us this evening, it's likely because you or someone you know, like your child or the students that you work with, are interested in pursuing a career as a dental assistant. You might be wondering what the role looks like day to day, what the educational pathway involves, and what it's like to practice in a rural or urban setting. I am very honored to introduce our speakers who are here to help answer those questions and share their experience with you. Maeghan Heck is a registered dental assistant in Alberta with more than 28 years of experience in the dental profession. She graduated from OUC in Kelowna, British Columbia in 1998 and has worked across pediatric, orthodontic, cosmetic, and family practice settings. For the past 20 years, she has served as both an RDA and Office Manager at a family dental clinic in Airdrie, where she is known for her patient-focused approach and strong team leadership. In addition to her clinical work, Maeghan is actively involved in professional advocacy. She currently serves as corporate agent for the Association of Alberta Dental Assistants and as membership coordinator for the Calgary Dental Assistants Association, contributing many volunteer hours to advancing and supporting the profession. Carly Simon is the Regulatory Compliance Manager at the College of Alberta Dental Assistants, where she works closely with dental assistants across Alberta to support registration pathways, professional standards, and regulatory compliance. She is a registered dental assistant with over 25 years of experience in the dental profession, bringing both frontline and leadership perspectives to her role. Prior to joining the college, Carly spent more than 6 years as an educator and program lead in a dental assisting program, where she supported students as they built their skills and prepared to enter the workplace. Cassie Sharp is the COO and co-founder of the Rizzio Institute for Digital Dental Education, where she spent the past 7 years pioneering accessible, high-quality training for dental assistants across Canada. With over 2 decades of experience in the dental industry, Cassie blends clinical expertise, instructional design, and entrepreneurial leadership to transform how dental professionals are educated. Her career began as a registered dental assistant and evolved into roles in post-secondary education. At Rizzio, Cassie has led the development of an online dental assisting distance delivery program, integrating cutting-edge technology and managing the institution's learning management system. Thank you all for joining us this evening. I will now turn it over to Maeghan to get us started.
Thank you, Emily, and thanks for everybody for joining us tonight. I especially want to thank Casey and Carly for helping me out with this presentation. So again, we're just going to talk tonight about dental assisting and why it's a great career choice. As my bio stated, I have been a dental assistant in Alberta for 28 years. I chose it as my career, and I've loved every moment of it. I can talk a little bit more about it as we go through our presentation. The presentation, we're going to highlight understanding dental assisting as a profession, career opportunities and benefits, education pathways, programs and support, professional development and associations, and how to get started, steps for high school students. So understanding dental assisting as a profession, we have several roles and responsibilities of dental assistants, and more importantly, roles as a registered dental assistant in Alberta. So we have clinical duties. So we prepare patients, we sterilize instruments, we follow IPC standards in the province of Alberta. We assist dentists during procedures, and we support the patients during their entire visit with us. We take x-rays and we record all of the medical documents that are required. And administrative responsibilities. Some of us will also do some answering the phone calls, booking appointments, doing predeterminations that are required for getting insurance coverage for dental treatment for our patients. So work settings and daily tasks. Common work environments. We work in private practices, such as what I have done, specialty practices, community health centers, also some hospital dental departments. So we have a wide variety of choices to work in. Myself, like it stated, I started out in pediatrics, so that's a specialty practice. And I also did orthodontics as a specialty. And then family practice, one was based more in cosmetic. And then now for the last 20 years, I've been in Airdrie at the family practice. So family practices typically will see a variety of procedures, whereas the specialty practices will just gear towards the specialty that you're dealing with. And there's several different ones out there: oral surgery, endodontics, which is more root canal, and implants. Those two will, both oral surgery and endodontics, will cover the implants that are getting more and more popular as well. I myself don't know much about them, but we are starting it in our practice as well. So we're always constantly learning as dental assistants. Tasks include preparing the operatories, assisting the dentist in the procedures, as simple as a filling to as complicated as implants or other surgeries. And we have to maintain the infection control, which is set standards by the province, and we have guidelines, and we can talk more about that as we go on with our requirements to follow all of our guidelines. There is a versatility in rural areas. Assistants are often combined to be clerical duties, like I talked about, administrative, like you're answering the phones, doing some paperwork for insurance predeterminations, but also doing the clinical in the back settings as well. And typically you'll have smaller team settings. So your versatility is important in those practices, willing to help out any way you can and making sure you're keeping up on all your clinical duties at the same time. Dental assistants spend about 60% of their time chairside, and the rest is on supportive roles, is typically what most of us do. Some are just strictly chairside, and some can do a variety of different. So there's lots of versatility. So skills and qualities to be a successful dental assistant: compassion and empathy are number one. You have to understand the patients that you're working with and understand their fears, building a trust and making it comfortable for them. Critical thinking and problem solving, assessing the symptoms and determining what the best course of action, always thinking ahead, makes a better dental assistant. I'm always a couple steps ahead of what, if I'm assisting the doctor in a procedure, so that I can determine what he's going to need next, so the flow goes easier. Technical proficiency and lifelong learning. Dental assistants need to be skilled in their radiography, sterilization, and using dental technology effectively. And you have to keep up with the new techniques and technologies and industry standards. So learning is a lifelong learning industry. We have requirements as our licensing board, regulatory board sets for us. But to make a good dental assistant, you're just going to want to constantly learn. You don't want to just do the bare minimum. You want to make sure that you're giving the best treatment you can to your patients, and then also to your team, your dental team. Communication and empathy. You need to be an effective communicator. You're dealing in a small area with individuals who may not necessarily are nervous, are scared, little kids that are really frightened, or it's a stressful situation. Some people handle stress differently. So having good communication and having empathy for the situation at hand is key. And communication with your team is important as well. And then work ethic. You need to be reliable, punctual, and dedicated. Your whole day relies upon your team. And as soon as one member of the team isn't there, it does make it harder for everybody. And then the patient care can be hopefully not affected, but it can be, because you're doing the job of multiple people then, instead of, if not everybody's of the team is going to show up. So you definitely need to take be punctual, be on time, and be reliable. Be prepared for your day and all your patients that you'll be seeing. Adaptability and resilience, handling unexpected challenges, because emergencies always happen. You can't control it. You might have a fully booked day and somebody has had an accident and they've broken their tooth in half and they're in excruciating pain. So you have to be resilient and adapt to those changes that occur. Also, during certain procedures, we're planning to do one thing, but it's shifted into another. It can happen all the time, and so we as dental assistants just need to be aware of that. Dexterity, you need to be good with your hands and be steady and coordinated for working in small spaces. It's a challenge for all of us, but as you progress and work more with a particular doctor, it gets easier, trust me. Things will get eventually repetitive, so it does make that easier, but you need to be able to multitask as well. Teamwork and stress management. Successful dental assistants excel in teamwork. So we have to be able to work well with others in all, whether it's with our patients, different personalities, whether it's with our teammates, as well as with the doctors. So you need to be able to handle your stress and understand and have, it goes back to communication as well. Great teamwork is good communication. Career opportunities and the benefits. So community health programs in rural Alberta are expanding. So I know there's an incentive to try and increase medical facilities in rural areas, and as I'm sure dental offices. And I know I live in a rural area. I live in Didsbury, Alberta. So I know that there's a couple offices in my community and some around in the surrounding small communities. So there's definitely opportunity for dental assisting in the smaller communities. I'm sure there's a higher need even in further rural communities. I personally aren't aware of that, but maybe some of my other panelists can touch base on what they know about that. There's a significant shortage of licensed dental assistants in rural areas, though. So there's always jobs. They're always looking for people. So if you currently work in a rural area and you want to return to that area, then you would be a great asset, I'm sure, to those offices once you have your training. And yeah, so once you graduate, prospects employment. I mean, it's a great way if you can connect with those offices in your community to see if there's any chance that you can observe or go in and help or get familiarized with how the clinic works, so that when you get your training done, you can come back and give your skills back to your community. So community impact and job satisfaction. Dental assistants improve oral health by providing timely dental care and education to local communities. So we always try to give back. I know in my career, I've always given back. That's the reason why I do a lot of volunteering for my profession. Community connection, stronger community ties result from dental assistants building relationships and fostering patient trust. So like I talked about earlier, having empathy and building a relationship with your patient that they'll return, and it's a continual, it's like almost family. And I've seen patients since they were little kids, and now they're getting married now within my career. So it's wonderful to watch them grow. And you know, they might come in every 6 months or once a year, but you see that growth and you remember them and you have that connection. It's a wonderful feeling. And I imagine that would be better, a higher, if you live in the area that you're working in, then you'll be more likely to have those connections with your patients because you'll know them. Higher patient appreciation and community support boosts job satisfaction and professional fulfillment for dental assistants. I know I feel fulfilled when I know I have that connection with the patient. And retention and fulfillment, positive feedback loops improve retention rates and enhance career fulfillment. So I've always felt wanted and respected, and I know that my connections with my team as well as my patients has given me complete satisfaction in my chosen career as a dental assistant. So I see it as a huge benefit to have those connections. So education pathways and programs and support. And Casey's here, and she'll answer some questions after the presentation, or she can chime in when I'm talking right now. Because Casey works at one of the dental assisting accredited schools, she'll have some feedback on how the accredited dental assisting programs work. It's been a few years since I went to school, so it's always good to have an expert be able to give her feedback as well. So program accreditation, and of course, the College of Alberta Dental Assistants, they recognize quality education. So they make sure that the program accreditation is set for these schools, and the curriculum is set, and the standards are followed. And the schools in Alberta, they include SAIT, NAIT, KDM. KDM has the location in Edmonton and Calgary, and Columbia College, which is based in Calgary. RISIO, they have a home base in Calgary, but Casey can talk a little bit more about it. And Reeves College, CDI College, and I believe the University of Alberta also has a program for dental assistants. Core competencies. The programs focus on infection control, dental anatomy, radiography, and chairside assisting skills. So you'll get the basic terminology and some hands-on experience at these schools before you graduate. And then the graduates are eligible for the National Dental Assisting Board exam with a 90% completion and high pass rates. And so you'll finish your schooling, and then you'll take that National Dental Assisting Board exam, and you can further on with your requirements with the College of Alberta Dental Assistants to become a registered dental assistant in the province of Alberta. RISIO, like I stated, is one of the schools and they base themselves with a rural focused program. So I'm not sure, Casey, did you want to step in and talk a little bit about the
Yeah.
RISIO, or did you want me to talk? Okay.
No, that's great. I can jump in. Thank you, Megan.
Yeah.
Everything that you've been saying so far, I fully agree with. Dental assisting is a great career path for all the reasons that you've said. And I would also add to that that it's a really great opportunity to be able to travel. It's a in-demand career. There's currently over 3,000 vacant openings across Canada for dental assistants. So there is a need. And I know personally, I have lived in Edmonton and Banff and Vancouver and Australia and Calgary working as a dental assistant. So it's a great way to be able to experience new communities and new cities. So as we're talking about the different education options, you mentioned the ones that are accredited in Alberta. And like you said, the majority of them are in Calgary or Edmonton. However, I was working at one of those schools prior to starting RISIO, and we noticed at that time that there is a barrier for students that want this career because there is lots of opportunities. However, traditionally, you'd have to move to either Calgary or Edmonton to go to school and leave your hometown and your job and your family commitments. And sometimes those students never move back to their hometown, so that those communities are actually losing really valuable labor force. So what we created was RISIO Institute, a distance delivery program where the theory is all delivered online. And it's in conjunction with a work integrated learning component. Our students are all working in a dental office in positions like administration, sterilization tech, or sometimes chairside dental assisting, where you're just passing the instrument, setting up the rooms. You're not doing the intraoral skills that you need to go to school and be registered in order to do those. So our students are working in their hometowns. taking the online theory, and they just come to Calgary, our Calgary Clinical Campus, for a 12-day clinical term halfway through the program, and then a 7-day clinical term at the end of the program. So our students and their employers find it quite manageable for the students to be away during that time, and then they go back and are able to do those skills in their dental office. So it's a apprenticeship style learning. You get a lot of mentorship from your team and lots of support. So some of the feelings of online learning are sometimes a worry that it might be a lonely journey, but you have us, but you also have your dental team that you're working with while taking the program. And yes, we have a 99% success rate on the national board exam, and we're very proud of our graduates. And we attribute that to that work integrated learning component, where they're seeing the skills as they're learning them. So we find that that's a great way. And in addition, it allows students that are in rural communities to be able to stay in their communities while they get a really great education and a really great career path. So I know you mentioned some of the different paths that you can take when you become a registered dental assistant, but it's really limitless. You can work in education, you can work in sales, you can work in management, you can work in those specialty offices that Maeghan referenced. So there's tons of variety and tons of options. Once you get that certification, it's really a great career to kind of launch a lifelong career in dental. So thank you, Maeghan. I'll pass it back to you.
You bet. So professional development and associations. So this is where I'll probably call on Carly Simon to talk a little bit, but I'll talk briefly about the roles of associations in Alberta, for Alberta. There are several associations even across Canada. There is a Canadian Dental Assistants Association, and they will be, actually, they've celebrating their 80th anniversary this year. So they've been around for many, many, many years. In Alberta, our associations are over probably 60 years. I don't know the exact date, but I've been a part of the association since I graduated. I like to give back to my profession, and that at the same time, I get to learn so many different avenues, and I get to meet so many amazing people and network in this chosen career I've set for myself. So as stated, I am the corporate agent for the Association of Alberta Dental Assistants, and I also volunteer with the Calgary Dental Assistants Association. And it gets a little complicated in the province of Alberta about associations, and trust me, we are trying to make it more simple for you. But basically, we have two local associations. One is home-based in Calgary, and the other one is in Edmonton. In the past, we had other associations throughout different communities in the province of Alberta, but essentially they sort of dwindled away, and finding volunteers is always hard. We all know that. So Calgary and Edmonton, we have more people to pull from. So we were the ones that kept going throughout all the different changes we have seen in the province of Alberta based on our regulatory board and our associations. So there's been several different changes. I won't bore you with all the details, but now we're looking at the future. So with Calgary and Edmonton, they are both partners, society partners of the Association of Alberta Dental Assistants. And so the Association of Alberta Dental Assistants is the one that connects with the Canadian Dental Assistants Association. We have lots of communication and different events that we hold. We advocate basically for all dental assisting in the province of Alberta. That's our main role as the Association of Alberta Dental Assistants. So we will do things like for a while now, we've been working on WCB coverage being mandatory for all dental assistants in the province of Alberta, because currently it's not. We work with other groups like the Alberta Dental Association in projects, some oral cancer screening. So we try to bring information to our membership and keep them up to date on all that's happening in their profession. So it's a great way to also to network. When we have conferences or other social events, it's a great way to, like I said, to meet people in our industry, and that can grow into growth and development into your chosen career. As Casey mentioned, you can take this as far as you want, or you can make it as simple as you want. There's so many different opportunities in dental assisting. We have member benefits, of course, different discounts at different shops and stuff. So that's another benefit of becoming part of your association. It's not mandatory to be part of the associations in Alberta, but I highly recommend it. I mean, I might be biased, but it is a way, and organizations have kept me up to date in everything I need to know. The information is there firsthand, and makes me proud to be a dental assistant when I'm part of the professional association. And we like to support each other. So our organizations are dental assistants helping dental assistants to better our profession. This is a summary of what dental assistants associations do. So like I said, it's not mandatory to be a member, but it is mandatory to become regulated in the province of Alberta to work as a dental assistant and to call yourself a dental assistant in Alberta, as well as a registered dental assistant. So Carly, did you want to talk a little bit about the role of the College of Alberta Dental Assistants?
That sounds great. Thanks, Maeghan. Just similar to Maeghan and with Casey, I myself also am a registered dental assistant and have been for over 25 years, as Emily mentioned in the beginning. And this career has been amazing, and it can take you into a lot of different avenues. And I worked in British Columbia, I worked here in Alberta, and I also worked in Costa Rica as well. And so just like Casey was able to travel with it, I was as well. Very rewarding position, lots of perks to being in the job as well. But my role currently is with the College of Alberta Dental Assistants. And as Maeghan mentioned, the dental assisting is a regulated profession in Alberta. So think about even like with nurses, it's a regulated profession. And I'm going to talk a little bit about what that means. So even the title dental assistant or registered dental assistant or DA or RDA, they actually are protected titles under the college. So you're not allowed to just walk in off the street and call yourself a dental assistant. You actually have to have taken one of the education programs like Casey was talking about, or one of the other ones that Maeghan, in terms of that list of accredited programs, and written that board exam and been registered with the college to be able to be allowed to call yourself a dental assistant. So what does that mean? What is regulation? First thing, I just kind of want to talk a little bit first to break it down. Casey was speaking about schools and training programs and things like that, talk about how to become a dental assistant and what you'll learn and how programs are and what student life is like. RISIO is a great one for rural communities. We really, really need more dental assistants in our rural communities. I can't tell you the countless phone calls that we receive from dentists that are struggling because they just can't get the help. So it is a job that's in demand. So with those of you who are in high school and you're looking for something where, what am I going to do after high school where I feel like I'm going to have security in a position? Dental assisting is a fantastic option for that. And now with the dental assistants associations, as Maeghan was talking about, they support the dental assistants in their careers through networking, resources, and professional support. They're really the cheerleaders of the profession, constantly advocating for you, looking into the WCB and wage reviews and things like that, and really taking care of dental assistants because there isn't a union for dental assistants, but the associations are fantastic with their advocacy for the profession. But then where do we come in? So the College of Alberta Dental Assistants, the word college kind of throws people off because we're not a school, we're the regulator. And that means our job is to protect the public by making sure dental assistants meet education requirements and follow professional standards and continue learning through their careers. So when we talk about public, we mean everyone. Basically anyone who sits in a dental chair is who we're looking out for. So why does regulation matter? Regulation helps ensure that when someone graduates from a dental assisting program and begins working, there are consistent standards across the province. So no matter where you go in Alberta, you should be able to trust that a dental assistant has met the same requirements and is practicing safely and ethically. So think about yourself when you go to the dentist and you're sitting in the chair, you're going to make an assumption that that person is educated and trained properly. And that's where we come in to make sure that that is happening within the dental community. So first, regulation protects patients. So like I mentioned, when you go to a dental clinic, you should feel confident that people caring for you are properly trained and accountable. Second, it protects dental assistants. Clear standards and guidelines help professionals understand what's expected and how to practice safely. And third, it builds trust in the profession. Trust is essential in healthcare. People need to know that they're in good hands. So I want to give you a quick analogy. I always find that this is the easiest one to kind of like, what is she talking about? So becoming dental assistants in Alberta is kind of like getting ready to drive a car, if that makes any sense. So when you guys are all taking, your learners and all that type of stuff, you had to go to school to do that, or take driving lessons, or have one of your parents teach you, right? So you need to have the right steps in place before you're even allowed on the road. So when you drive, you need a valid driver's license to prove that you've been trained, you've done some sort of education. You also then need vehicle registration. So if something was to happen, even if you're just going through a check stop, they're going to say, "Can I have your registration and your insurance?" That's showing that your car is approved, and your insurance is to protect you and the public if something goes wrong. So now let's pull it back to dental assisting and find where that side of meets up. So in dental assisting, it works kind of the same way. So you're going to complete your education, like a program like Rizio, and you're going to be able to work towards writing that board exam to get your license. At that time, you're then going to register with the College of Alberta Dental Assistants. So that's your registration. And then through that as well, you're also going to get liability insurance that's going to protect you if an accident occurs. So that's your insurance piece. So just like with driving a car, these safeguards are there to keep everyone safe and make sure only qualified people are providing the care. Where the associations come into play is, think about it as if you got an AMA membership. There's always perks with those. So you can get movie tickets and you can get travel discounts, but they're also discounts and advocation for things that are doing to auto related. Well, with the associations in dental, it's the same way. They're going to provide membership and provide benefits and support. Okay. With the College of Alberta Dental Assistants, it is mandatory, whereas again, as Maeghan mentioned, it's not mandatory to become a part of the association. Kind of in a nutshell, the college exists to serve the public interest. The Alberta government gives us this responsibility through legislation called the Health Professions Act, which gives us the authority to regulate dental assistants in Alberta. So at the end of the day, dental assisting isn't just about teeth, it's about people, health, and trust. And regulatory bodies like the College of Alberta Dental Assistants exist to make sure that trust is earned and maintained. So schools educate, so that's your pathway to get your dental assistant license. The college regulates, so registration, like your car, protect you and the public, and only registering those who have met the provincial standards. And associations support with perks, support, advocation, and advocation to the profession. So
Awesome.
That's me in a nutshell.
You make it so easy. You made that analogy so amazing.
Right, just that click part is kind of big.
Yeah, it's awesome. So continuing education and career advancement, like I mentioned before, it's a lifelong learning career. So professional development, you can take orthodontics, new technologies, digital radiography, expanding clinical functions, and management skills. So I'm always constantly learning. I'm taking dental courses. The associations offer some educational events as part of their fee to become a member. The benefits are it helps you grow. It improves your wages. And mobility, your job mobility. The more skills you have to offer, the practice, the better off everybody is, including yourself. Online learning for rural assistants. There are some dental courses, online learning that you can take as well through our association, and other programs offer it as well. So how to get started. And Casey, you might want to jump in a little bit, but I'll just kind of go off here. Shadowing. I shadowed as a high school student, I through career and life management course, I got placed in a dental office that took me on and taught me the ropes and what it was going to be like to work as a dental assistant in the office. Of course, I wasn't doing any of the intraoral skills that you needed to do so I was doing sterilization. I was trained on the job, and I knew then and there that that was what my career choice was going to be. So I highly recommend at least observing in an office for a few hours, if not multiple days, if you can. It just depends on the practice. If you find somebody that's, or even if you can, my practice as I'm the office manager, I just hired a girl who graduated from high school a year ago, but I'm training her to become our steri tech. So she's going to restock the operatories. She's going to assist the hygienists with charting, and she will be taught to do the sterilization in our practice. So she's interested in doing dental assisting as a career path. So this is her way of introducing herself to it and making the decision before she just jumps into the schooling. So I definitely recommend that. So hands-on exposure, and then structured shadow programs. So I know a lot of the schools, I'm pretty sure it was when I went to school, I had to prove that I did shadow in an office for a few hours. So that office had to sign a paper, and I've signed it several students as well. So hopefully at least shadow in an office to make sure that that's the career choice for you. But RISIO program, as Casey had mentioned, is kind of set up where you do some hands-on, you get hired on, and you learn and you grow and you do the program while you're doing it. So there's a lot of opportunity. Do you want to share anything, Casey?
Yeah, I'd love to. I'd love to add that we love to see high school students entering the profession because we need more of you in our profession. So exactly like Maeghan did, if you can get in working and shadowing in a dental office, even while you're still in high school, it will allow you to get a jump start on that career. So RISIO also has a free online dental course that's just a very high level overview and includes some terminology and things. So you can take that and as a starting point, and then you can approach a dental office and be like, hey, I'm interested in this career path. Can I shadow or can I be trained? Like, I love that Maeghan is taking on a newly graduated high school student. That was amazing. And we also have a dental aid course, which is just that sterilization component. So it's a much shorter program, much more affordable, and it allows people to get their foot in the door, get that first sterilization job, and then you can take the rest, the full program by distance delivery and still continue to work in that office. So you're not losing out on a paycheck, you're still getting that mentorship, and you're still getting paid work. So because the industry is so in demand, the profession, you can actually, even at a younger age, you can get hired as steri tech for evenings and weekends and holiday coverage. So some of the more seasoned dental assistants might not want to work those hours. So it's a perfect way for a high school student to work a summer position, evenings and weekends. And it's also really great to do that role, even if you wanted to take a second career, you can use your dental assisting to then work your way through more schooling as well. So it's a really, really flexible and really great career option. So yes, all that to say that if you can, start in a dental office younger, we welcome you into the profession at a younger age.
Great. That's awesome. Thank you. Yeah, so I guess each program has their how you need to enroll in the program. So each school is different. So I'd highly recommend that you check out their websites. And like Casey said, there's different programs. Like there's the steri tech and as well as the dental assisting careers. So definitely check out. I believe some of them may even have an interview process. So be prepared for that as well. And then in conclusion, I just want to say that definitely embrace dental assisting as a career choice. I am a little bit biased, like I said, but I love this profession even way back in high school. So, and it's been challenging, but it's been, such like it's just a blessing that I can have this lifelong career, and I've grown and I've gotten to the point where I want to be in my career path, as I'm sure Casey and Carly have as well. So it's very rewarding. There's multiple educational pathways, and then community impact on oral health is in high demand, as we've said. So definitely consider it, and hopefully we'll see you around at one of the multiple events that we have in the dental community. So that kind of sums up our presentation tonight. I'll just send it back to you, Emily.
Great. Thank you so much, Maeghan, and thank you for all of you for sharing your wealth of knowledge with us. I found it very interesting, and I'm sure the students that we have on the call did as well. We will now open up the question period. So if you have any questions for our lovely speakers, please send them in to me through the chat feature, and I'll relay those questions. We may not be able to get to all the questions. However, I think we have about 10 minutes to go. So yeah, if you have any questions, this is a great time to send those in. And we'll also provide contact information through email as a follow-up. So if you have a question later on, you're welcome to email us or our speakers as well. And I have a few questions to get us started. And there's also one question that came through the chat so far. The question that came through the chat was, what was the introductory course that Casey was talking about, and is it free? Casey, I wonder if maybe we can get the link to that course, and we can either put it in through the chat, or we can include that in our follow-up materials as well. So
yeah, definitely. I'll put it in the chat here in just one moment. The high level course is just called, it's a free online dental course, Foundations. It's through the RISIOdental.com website. It's talks kind of about like, what are x-rays, what are the different procedures, what are the tooth numbers, some of the terminology. So pretty high level, but we offer it for free. It's available for everybody. And then the next tier up is dental aid. It's just under $1,000, and we ask the students to purchase the textbook as well, the Modern Dental Assisting textbook. And so that one is all about microbiology and infection control, disinfection and sterilization, as well as some instrument ID and instrument transfer. So things you can do is a very introductory level, but still very valuable to the dental team as a support person. So that's called Dental Aid. It's $985 plus a textbook. And then once you're working in the dental office, then you can apply for the full dental assisting diploma program. So I'll grab the website and put that into the chat.
Perfect. We also have another follow-up question on that same program. The free dental basics course from RISIO, does it allow you to receive a certificate or a badge to show completion?
No level, no certificate, no level of completion, because we're not testing on that. It's just simply knowledge availability. So you can definitely put it on your resume that you've taken that course, but we don't provide a certificate for that one.
What high school courses are required to get into the dental assisting diploma programs?
For RISIO Institute, you can apply with either your high school transcripts, or if you've been out of school for a couple of years, you can be a mature student and apply that way. You do need your grade 12 English with a 60% final grade, as well as we do require that interview that you mentioned, Maeghan. So we want to make sure that you're you know exactly what you are signing up for, and that you're a good fit for this program, as well as that work integrated learning component. So that's unique to RISIO. The other schools that are more of a traditional brick and mortar wouldn't have that component where you have to be working in a dental office. For us, it's a minimum of 14 hours a week. So it could be 2 days, or it could be spread out throughout the week. But we want to make sure that those students are able to tie the theory to the real life experience. So it is a requirement for RISIO.
I can probably speak a little bit too to that as well in terms of the education standpoint, depending on the programs that you're going to. RISIO is great because you can do it from home because it's distance delivery. But as both I think Emily and Maeghan had mentioned, the majority of the dental assisting programs are either in Calgary or Edmonton. And with those programs, some of the things to really pay attention to if you're in grade 12 and you're in that final semester is your biology is a big one. If you did decide to take it for bio 30, but some of them only need bio 20, or even just the basic science 20 or science 30. And then the English component as well. But it's really worth looking through the different accredited programs on the website. You can even access it through the College of Alberta Dental Assistants. There is an area there for education that I'm happy to also pop into the chat. It'll show you all the schools that you can take dental assisting education here in Alberta. And you can click on those to see if there's one that suits for you. If you were thinking of moving to Alberta or Edmonton or Calgary, you're in Alberta, and what the requirements are for enrolling.
What do you enjoy most about being a dental assistant?
The thing I enjoy most is probably the patient care and then the teamwork atmosphere. Having the dental hygienists and the dentists, and then of course us registered dental assistants in the office, and then now even bringing in the SteriTechs. So having those different levels and the admin team, those are crucial to me. That's what I like. That's what I enjoy. I love seeing other people. I love being around people. That's probably the best. And then of course patient care. I just loved helping others. So
yeah, I would agree with you too. The team members that I've worked with over the years have been amazing. And I think this career attracts some really great individuals. And then I've touched on it a little bit too, but the ability to have employment wherever you end up working, whether you're relocating for maybe for fun or for a partner's job or for your own career advancement. There's so many reasons why you might end up relocating, and the variety of the day. So it's a day that goes by so fast. In the dental clinic, being the dental assistant, you are constantly being put in different situations, and so I think that variety, like no 2 days are the same, and I love that. Like the days would fly by. So those are my favorite things.
If someone is considering dental school in the future, would you recommend assisting first, focusing directly on university prerequisites?
Yeah, I think that's an individual, in perspective. I think it's really great to be able to work while you go to school. So, and all this foundational knowledge is going to help you when you go to dental school. And you can also have a really rewarding and high-paying part-time job while you are furthering your education. So my very first dentist that I worked for in Banff, he was a dental assistant before he became a dentist. So I think it's a really great pathway. Dental school is competitive, and so it's a nice stepping stone to other careers as well.
Are you able to share what the starting wages are upon graduation?
This is always a tricky one. The associations the Canadian Dental Assistants Association did a survey a few years ago, and it differs between province to province because each province has different skill levels that are required. In Alberta, we are the highest trained skilled dental assistants across Canada, and our requirements and IPC training is higher than anywhere else. Carly can probably attest to this as well, but it's a tough one because everybody's different. But in my practice, I can speak on behalf of what we offer new grads. It's anywhere from $21 to $25 is what our practice offers to start with. Usually our doctor will want to start on the lower in the first 3 months, and then once you've given us knowledge of your skill level and your dedication to the team, then we typically will increase that after the 3 months. But I would imagine that's the average. I could be wrong. I know some of the study was done a few years ago, and some provinces look really low. Some are like $18 to start. But in Alberta, you'll typically get a higher start. And I'm sure in the rural areas, it could potentially be higher as well, just because it is in high demand. But you also have to take into consideration, and I try to explain this when I talk, it's not all about the wage. It's also about what benefits are offered as well. Some offices will offer a multitude of benefits and some will offer less. It just depends. The private practices can sometimes offer less because it's just an individual doctor, but there's corporations that are out there that offer, they have a multitude of people so that they can offer better health and dental benefits. Typically, what I've seen in my career, I've always been offered dental as a benefit, as well as extended health benefits, a health spending account, uniform allowances, educational events, continuing education, that's paid for by some of ours. I've also had extended education like the orthodontic module paid for by my employer. So those sort of things have to be factored in as well. I guess on the high end of dental assisting though, as you've been in it for many, many years and you've increased your education, you can get up to the higher end where office managers could potentially make 35 to 40 roughly. Again, it's all over the board. It just depends on what you have to offer, how you ultimately sell yourself and show your skills off. And if the doctor deems it a merit, then you'll make more, right? You give more, you make more. That's how I see it. I don't know if Carly or Casey want to chime in on that, but it's a delicate topic sometimes.
Yeah, the wage part again, the associations are fantastic. They're the ones who definitely are fighting for, fair wages here for our dental assistants in Alberta. The college doesn't really speak to any of the wage component, but if I take the college hat off of when I was an educator as well as a dental assistant myself, Maeghan's not far off. That's what it definitely looked like. But it is subjective to the office and it is subjective to the additional benefits that you're receiving.
How long does it take to become a dental assistant? I believe most programs are about 2 years, but please correct me if I'm wrong.
There is a difference in the length of the program. So there are some that are 6 months long. There's some that are 10 months long. And then our distance delivery program is actually 21 months long. Okay. And that's because our students are typically working full-time. We do have students that can accelerate that if their commitments allow for it. So we have had students complete it significantly faster. So it just depends on what type of program you're looking for. There's quite a difference in the length.
And last question, what advice would you give to someone who's just starting to think about this as a career?
I would say what Maeghan already said about shadowing. I think that's a great way to get your foot in the door and see if that's a good fit. So the community is wonderful and welcoming, and we want more dental assistants. So please just make that connection with your local dentist. And typically, I know I went to my dentist when I was interested, and I shadowed at the dental office where I went as a kid. So I think that's a really great place to start, and then you can go from there.
Thank you, everyone. Thank you to our presenters for sharing their experience and and their advice with everyone. I'm sure you've inspired a few students to explore a career in dental assisting, so that's very exciting.